Hi guys, welcome back to Code Master Coach, your medical coding tutor. Guys, today I'm answering the question, why CPC certification? And for me, I can answer that question this way because I'm often asked, Coach, you have a master's, you have your bachelor's degree and your RHIA, you have your CCS and your CPC. Why do you prefer teaching for the CPC certification? And it goes to show that I've been in coding for I think this is my 38th or 39th year in health information management. And I probably spent the last 20 years in physician or professional coding. I can think back to a time I can almost remember when hospitals got one check. They paid the physician, nurses, lab, radiology, respiratory therapy, all the ancillary services, medical records, business office, maintenance, environmental services, all paint, carpet, all of the upkeep that was required to maintain the hospital out of that one check that they received. But how many of you know physicians wanted more and more money? The hospital tried to pay the physician more money, but as they paid out of that one check the physician more money, they had to make cuts in other areas. The money just wasn't there. So physicians got smart and started their own classification, CPT, so that they can receive their own reimbursement and not count on the hospital to give them reimbursement. And also think about it, healthcare since then has changed. Where we only had either at home or in the hospital, now we've got observation, we've got emergency room, we got physicians' offices, same-day surgery, nursing. We've got a whole lot more settings now than we had years ago. So as healthcare expanded, the coding expanded, which reimbursement expanded. So the downfall to the hospital paying the physician more and more money, they were taking the cut. So with the physicians having their own classification to capture their reimbursement, it's requiring two coders, a professional coder for the physician and a facility coder for the hospital. I've coded on both sides, but the physician side really interested me because, one, I got my start with a physician that was just starting his practice, and he needed a coder to come in and capture reimbursement for him. And I can remember the hospital contacting me and saying, are you going to capture your physician's emergency room visits or hospital, rounds, the E&M for the hospital rounds? And I was thinking, I'm just his physician office coder. No, I'm his professional coder. I'm his moneymaker. I've got to be that well organized that wherever my physician went, I was the one coder for him. So I wanted to capture those charges for him. So I had to come up with ways that my physician could communicate with me even on the weekends when I worked Monday through Friday, 8 a.m. to 5 p.m. So I wasn't thinking about, the weekend until I realized, my physician is seeing patients on the weekends. I need to capture those charges. And that interests me. What was my physician doing? The hospital visits, when he was making his rounds, what all was he doing? During his procedures, what all was the physician doing? So this really interested me. So that's why I really got into CPC certification, because the CPC certification is the certification for professional coding. To better understand this, I always tell people there are two national organizations, AHIMA, www.ahima.org, and AAPC, the American Academy of Professional Coders, www.aapc.com. And that's where you'll find all of the different certifications. Now, as far as AAPC is concerned and the outpatient or the CPC coder, they've even gotten into specialty certifications like anesthesia or dermatology or urology, or there's so many different specialty certifications. But I always tell my students, don't confine yourself to one particular specialty. Get your CPC, which is supposed to be well-rounded. Okay? That covers all of CPT. I always think back, and this could be controversial, but I'm going to throw it out there and see what kind of comments I get back. Raising my two sons, I'm an older woman, so back in my day, raising my two sons, I said, okay, I want one to be a doctor, and I want one to be a lawyer. I started to say a lying lawyer, but I'm just going to say a lawyer. I wanted a doctor, and I wanted a lawyer. But after being a professional coder and realizing how third-party payment has really jumped in and confined the physician, and it almost needed to be done. Think about it. As a physician, you can charge your office visits based on what you want to, and I can see where those costs could have gotten out of control, and so the third-party payers had to get involved and say, look, this is your pay scale that we will reimburse for our subscribers. Think of insurance companies, Medicare, Medicaid, Blue Cross Blue Shield, other commercial insurances. If you have insurance through them and your physician has agreed to be a participating provider through them, then that physician agrees to accept the payment based on the pay scale that those third-party payers offer. And so when I'm coding and I'm doing, as in the physician's office, you tend to do the coding and the billing. At least I did. Smaller physician's offices. And so with charges, I was amazed at how much control third-party payers have. We could charge $120 for the office visit. But if the patient had Medicare or Medicaid, we were lucky to get, for a $120 office visit, $38 from Medicaid or $48 from Medicare, even though my physician would charge commercial $120. So when I started seeing the reimbursement, I was quick to tell my two boys, okay, both of you guys I'd rather you go into becoming lawyers. Become lying lawyers, become lawyers. That way you can set your prices, because physicians, to me, are confined. And again, I do understand that their rates did get out of hand. And so somebody had to step in and bring them in. But when you see some of the money that is written off that the physician wanted to charge, but the third-party payer didn't reimburse, you're going to be amazed. But anyway, so I'm just curious, what is your opinion of that? You notice from what I had, about 41, 42 ICD-10-CM 2025 official guidelines videos, my purple notes, which were Codemaster Coach notes, which meant those were my interpretations of those guidelines, how I interpret them. That's how I interpret reimbursement for physicians based on third-party payer scales. It's hard for a physician to make money nowadays, unless they're cosmetic, unless they're performing, breast implants or BBLs or whatever, and you just pay straight cash for that. But otherwise, we don't see physicians driving Jags and nice, expensive cars like we used to, because the reimbursement just isn't there for them anymore. But anyway, just wanted to have a sit down and talk about why I chose CPC certification. I enjoy reading the op reports. I enjoy reading what my physician does when he goes in and talks to the patient and trying to capture those office visits or those hospital rounds or those observation or ER visits from a physician, from a professional standpoint. Because remember, there's always two sides to coding: facility and professional. So when I look at my physician, I always say, I am your moneymaker. I'm your moneymaker. Okay? Again, guys, if you're interested in starting your coding profession, CPC certification, email me at codemastercoach@gmail.com, and I'll gladly send you information on my medical coding program. I'll be starting my next class next week. Today is supposed to be the last day. We're going right on up. Sunday, I will be emailing all registered students, welcoming them to the class. So, guys, get in. It's not too late. Thanks, guys. I'll see you in the next one.